Welcome. I'm Andrea Clessy for Woman's Hospital. The study of genetics is the cutting edge of medicine. So what is the role of the geneticist in helping patients? Dr. Duane Superneau explains.
The role of a medical geneticist is to work cooperatively with a patient's physician or healthcare provider in order to provide information to their patient or the family of that patient regarding genetic aspect of disease. Is there a particular process here that could be inherited, run in the family? And if so, what might the family expect? And is it possible to diagnose early before the onset of disease so an individual can be prepared to take the proper steps for health care? And then to share that information back with the patient's physician and healthcare providers in order to provide a good, comprehensive approach to medical care. The field of medical genetics has quite a diverse array here. A clinical geneticist may be an individual who's gone through college, medical school, and then specialty training in the field of genetics in order to provide genetic care as a physician. The individual may have a college degree and go through a graduate program, receive a PhD, and in that aspect may deal more not necessarily with the individual in the biological sciences, but cooperatively with physicians to do research, to run laboratories that have to do with DNA diagnosis, biochemical diagnosis, cytogenetic diagnosis, which is to look at chromosomes of individuals in order to diagnose disease and to help manage disease. Individuals can go through a college curriculum, receive a master's level program, and become specially certified as a genetic counselor, kind of like a mid-level provider for a geneticist to work with them to help care for patients and families. We have to remember that really the primary physician of a patient is the frontline geneticist, because they have to recognize processes within the patient, understand that the basis of that particular process, disease, or disorder may be genetic in origin. But the detailed knowledge about gene expression, and gene diagnosis, and perhaps some of the intricacies of the individual disorders and what it might mean for the person's health would be best explained through a geneticist who deals with this on a regular basis. So that's why a medical geneticist works cooperatively with the primary physician of a patient, the primary healthcare provider, in order to kind of expand upon, give more detail to what's going on with the patient about the genetic aspect of disease. Because genetics is such a specialized field and a small percentage of the population really has truly genetic disease, you're likely to find medical geneticists in larger population areas. The more rural area may have access to a medical geneticist through a nearby community or through an individual at a university academic center. They may also have rural clinics where a medical geneticist may travel to a rural center where individuals can be seen. The field of medical genetics is growing as far as the information being available to families now through the internet, through different opportunities. They can become informed about genetic aspect of disease. Unfortunately, I think there's still a large number of positions for individuals who have expertise in medical genetics, so that I think that while the field is growing in knowledge and need, we don't have enough individuals to supply that need and meet those demands. As more individuals go through genetic counseling, that's a mid-level provider aspect for clinical genetics, they can work cooperatively with basic physicians to provide that information to patients. But we do need more individuals in the various fields of genetics, because we have those who are experienced with DNA, those who are experienced with the biochemical aspects of genetic disease, those who are experienced with the cytogenetic, chromosomal aspect of genetic disease, plus the physicians themselves who are delivering that service and care, plus PhD and researchers. There's a wide open field and a lot of job opportunities. We need more individuals in medical genetics. The best part of my job is to perhaps dispel uncertain information in families' minds about what genetic disease might be, what it implies for the family, and to reassure moms who have babies that might have birth defects that they believe might be contributed to by something they had control over, to reassure them that it's not the mom and dad's fault for the process going on in the child. Relieve a lot of guilt and distress and anxieties that moms may feel about having had a baby that was born with a birth defect that in fact had nothing to do over which they could control.
For more information, visit womans.org. Womans, exceptional care centered on you.